Baragwanath Hospital in Johannesburg, the biggest hospital in South Africa, was going through a rough time during the public servant strike the past 2 weeks. Nurses went on strike for higher salaries, and those nurses that want to continue with their duties were intimidated by the striking nurses outside the hospital. Many patients didn't receive the treatment they needed. I'm here at Kusani Baragwanath Hospital in Soweto, Johannesburg. I'm here to find out the impact of the strike on the treatment of children in the hospital. Even the children at the hospital were also affected by the public servant strike. I went to one of the children's clinics at the hospital and spoke to a nurse. I asked her what the challenges were they faced at this clinic and how did this public servant strike affect the children in the community who needed the treatment at the clinic.
What is happening? We have our children who are missing on their treatment called chemotherapy, and once we've started with this treatment, you cannot miss it. So unfortunately, because of the strike, this is what is happening. Most of our patients are not coming, especially those who are coming from the northwest, because they come with a hospital pass. I spoke to a mother who brought a child to the clinic for treatment. She said things hadn't been so difficult for her.
Let's say from January, angithi angeke uyibone, angeke usheshe uyibone. Inesikhathi uzobona ngiyama-kidney especially uyibone isisu somntwana siyakhula noma lose appetite.
This is what some of the people had to say on the streets of Johannesburg.
Well, I think that what the nurses are doing to the children it's unfair.
I think children are very innocent, and that this strike is affecting them in the sense that they don't know what's happening out there. And then the nurses, on the other hand, I think they are being unfairly treated.
While the unions and the government are trying to agree on something to end the strike, the army, the volunteers, and the nurses who are on duty are doing their best to give the patients the treatment they need. I'm Colin, reporting from Johannesburg.